Good evening, everybody. It's Congressman Dean Phillips, and I want to thank all of you, over 4,000 of you on the line right now, and we continue to dial out many more thousands. So we will begin here in just a moment. Before we do, I know some of you have already completed the poll that we announced a few minutes ago. We'll give you one more chance to do that, and then we'll get our night going. During the course of the evening, please press *3 if there's any question that you'd like to ask, and you'll be connected to a member of my team. And if we can't take you live, I promise you that our team will get your question answered one way or another. That's my promise. And you can press *6 if you're interested in signing up for my updates from Washington on the work we're doing in Congress. And one of my team members will take down your email address and get you signed up. So before we begin, we're going to start with a poll. And the question for the first poll is, when the vaccine is made available to you, how likely are you to get it? Press 1 if you plan to get it as soon as possible. Press 2 if you plan to wait and see. And press 3 if you do not plan to get the COVID-19 vaccine. Again, press 1 if you plan to as soon as it's available to you. Press 2 if you plan to wait and see. And press 3 if you do not plan to get the vaccine. That's the first poll of the evening. In the meantime, I want to thank all of you, thousands of you on the line right now, and thank our extraordinary panel this evening and guests, Senator Tina Smith, Commissioner Jan Malcolm, Dr. Tim Schacher, and Dr. Necka Cederstrom for leading their extraordinary efforts in our community and for joining us on this call. We're going to start tonight with Senator Tina Smith, who you all know and doesn't even need an introduction. She is one of my two favorite senators in the United States Senate. Of course, our Minnesota senator since 2018. Prior to that, she was our lieutenant governor. Among her committees, she serves on the Senate Health, Education, Labor, and Pensions Committee and has been an extraordinary advocate as we have generated our COVID-19 federal response. She's an extraordinary leader, an extraordinary legislator, and an extraordinary human being. I'm honored to call her my friend. Senator Tina Smith, I'm going to turn it over to you for your opening remarks.
Well, thank you so much, Congressman Phillips. Dean, I think I'll call you Dean on the call, if that's okay.
Please
I promise
do.
to call me Tina.
I promise.
We all we have been friends for a long time and colleagues since 2018-19, and I'm so grateful for you for organizing this call to help all of us in Minnesota understand and have our questions answered about the COVID-19 vaccines and kind of where we are right now. And to have Commissioner Jan Malcolm, the Commissioner of Public Health, Minnesota Department of Health, to have Jan with us tonight is really a treat. I'm so grateful for your service, Jan. And I'm also really grateful to have Dr. Timothy Schacher and Dr. Necka Cederstrom also join us to answer all of our questions. You know, I think that in this moment, we have lived through what has been an unbelievable public health and economic crisis over the last year. I suspect that many people on this call have been in this month of March thinking about where you were a year ago, how this year has changed you and your family and everything about our lives. And I hope that all of you have had a safe year. And I know also, though, that many, many, many Minnesotans have lost loved ones. It has been a hard year in so many respects, and it's affected us all, directly. One of the great ways of describing this came to me from a Minnesota farmer who said, with COVID, we are all in the same storm, but we're not all in the same boat. And I think that captures so well how it has affected everybody, but not everybody equally. And in fact, we know that COVID has really laid bare some of the deep inequities in our community that we have to see and deal with. In this moment, spring is around the corner. We are not out of the woods yet, but I see many causes for optimism. Certainly, as I know our medical experts will tell us tonight, we need to stay vigilant. There are some concerns about cases starting to tip up in Minnesota and around the country. But we also are so optimistic about these vaccines that are more and more increasingly available to Minnesotans. Jan will tell you, but I think we have over 2 million Minnesotans who have now had at least one dose of a vaccine. And of course, Dean and I worked so hard to get the American Rescue Plan passed, which includes direct economic help to individuals and small businesses, help to get our schools reopened safely, and help with vaccines to get them distributed and to support that distribution effort in Minnesota. And I'm really proud of the provision that I worked on to make sure that no one will experience any out-of-pocket cost for the vaccine. So tonight I'm really happy and excited to hear from our experts, to be part of this teletown hall with Representative Phillips, and I look forward to the conversation very much. Thank you, Dean.
Thank you, Tina. So grateful to have you with us tonight and for your wonderful work. And I want to associate myself with the Senator's remarks. We know how difficult this year has been, health, security, economic and otherwise, and we're pleased to let you know that there is light at the end of the tunnel, and in no small part because of the topic of tonight's conversation, which is about the COVID vaccines. And many of you know that my mantra is representation begins with listening, and we're going to do a lot of that tonight, but we also brought everybody together to share information. There is misinformation, some disinformation out there, and we want you to hear the facts from the people and experts that know it the best. And there's a lot to talk about, so if you have a question this evening, you can press *3 anytime. *3 for a question. We're not going to be able to accommodate everybody's, but we will certainly follow up with you one way or another if you leave information and have everybody's question answered. And if you want to sign up for updates on my work in Congress, press *6 and a member of my team will help you. Again, that's *3 for questions and *6 to sign up for updates. And we're going to have some live questions towards the end of the briefing. And once again, if we don't get to you, we will follow up and help answer any questions. For those of you who don't know me, I'm a lifelong Minnesotan. I'm a father, a husband, a small business owner, an entrepreneur, and a representative in the United States House of Representatives since the 2018 election. I have always believed that Republicans and Democrats must return to placing people over partisanship. That is my mission in Congress. I'm the vice chair of the Problem Solvers Caucus and trying to repair our country and restore everybody's faith in our government, especially during these extraordinarily difficult times for everybody. The hardships of the last year are extraordinary, nothing that any of us could have ever imagined. But Senator Smith and I and our colleagues are on a very intentional mission to get us through this as healthy, as economically sound, and prepared for a bright future as humanly possible. Tonight's conversation, though, will specifically focus on the COVID-19 vaccines. And I look forward to hearing your questions, your ideas, even your criticisms as we learn more about getting vaccinated against COVID-19 in Minnesota. As many of you already know, 3 vaccines have already been authorized for emergency use by the Food and Drug Administration, the FDA so far, and extensive clinical trials have found the vaccines to be safe and effective. It's important, safe and effective. The vaccines available to Minnesotans are safe and effective. It will be offered to American citizens at no cost as well. Something else to note, there is no cost to being vaccinated in the United States, so please do not fall victim to some of the scams that are out there if someone asks you to pay for it. Most recently, Senator Smith and I joined our colleagues in Congress to pass the American Rescue Plan, which includes $20 billion to support our national COVID vaccination program and $50 billion for COVID testing. That's how we're going to get through this and get our economy and schools and country back open. Once again, as a reminder, if you want to ask any question during the course of the call, press *3, and if you want to sign up for my newsletter, press *6. And at any time you need information for any reason whatsoever, always visit my website at phillips.house.gov. My team and I are always here for you. We have your backs. We ask you to keep the faith and always keep in touch. With that, I am honored to introduce Commissioner Jan Malcolm, who has served as our Commissioner of the Minnesota Department of Health since January of 2018 after an extraordinary career. Commissioner Malcolm has worked closely with the governor, with our remarkable health systems, our local governments, and so many other community leaders to lead Minnesota's COVID response. With that, Commissioner Malcolm, I turn it over to you for your opening remarks.
Well, thank you so much, Congressman Phillips and Senator Smith. I appreciate you inviting me to be part of this town hall. As Senator Smith and Congressman Phillips have said, this pandemic has touched all of us in ways we probably could not have imagined a year ago. And it is a remarkable scientific achievement that we have 3 safe and effective COVID vaccines available in only less than a year's time after this novel virus racing around our globe was first discovered. And the fact that we are now in this point where we have a weapons against this virus is just a fundamental shift in our ability to get to the other side of this pandemic. And we are very, very grateful for all of the work that Minnesotans have put in this year. We have done, I think, as a state, a good job making the best decisions we could about how to keep the public safe while paying attention to the negative effects on our economy and our well-being as people. But that has come because Minnesotans have really rolled up their sleeves and taken this seriously, done the right things to protect themselves and each other, and certainly businesses have sacrificed as well. This is an optimistic time with the vaccines here and rolling out. And we know that the earliest parts of the vaccine rollout have been frustrating for a lot of folks. It's taking time to get the vaccines out to everyone as the supply of these 3 new vaccines slowly grows. We know the waiting has been difficult, and we appreciate the patience that Minnesotans have shown and the fact that Minnesotans understand that we've been trying to vaccinate the most vulnerable people first. But we have a strong commitment to continuing to make eligibility increasingly broad. Every Minnesotan that wants the vaccine is going to get the vaccine, and we're on a good pace to make that happen more quickly than we had thought, even a couple of months ago. We are making really good progress with our vaccination efforts. As Senator Smith said, we've now given over 2,270,000 shots to over 1,450,000 Minnesotans. And that's about a quarter of our state's total population who've had at least 1 dose of one of these vaccines. Almost 863,000 Minnesotans have had the full vaccine series, the 2 shots if it were the Pfizer or Moderna, 1 shot if it's Johnson & Johnson. And I'm really happy to say we're getting close to having 80% of all people 65 and older in our state who have had at least 1 shot, and over half of them are now fully immunized. And that is just phenomenal when we seek to protect the most vulnerable among us. We reached this milestone of 2 million COVID-19 doses earlier last week. And that first million doses took us more than 2 months to administer. The second million took us less than 1 month. So the pace is picking up. And we have increasingly been able to get vaccines out to a growing network of providers who actually deliver the vaccines, our hospitals, our clinics, our pharmacies, our local public health partners. Increasingly, we will be seeing community-based vaccination sites spring up, and some employers are interested in doing worksite-based vaccination. This diverse, growing network of vaccinators is going to help us get to everyone who wants a vaccine when it's their turn, and there will be a turn for every Minnesotan. It's very important, though, that we make sure that we are reaching all communities, especially those who have been hardest hit by this virus. And Senator Smith made mention of that, the disproportionate impact of COVID-19 on many of our communities. And as we really always have to keep in mind, even though we're now in a very hopeful place with vaccines rolling out, we do need to be careful. We need to be cautious and to remind Minnesotans to continue to take COVID-19 seriously. I know how tired we all are of it, but it's very critical that we keep paying attention to those prevention strategies that we know help us keep the cases down, keep people out of the hospital, keep protecting each other. It's very important that we still are wearing masks, paying attention to keeping physical distance, and taking other precautions like getting tested when we have any symptoms at all or think we may have been exposed. So we have to keep going in the right direction here. You probably are aware that we are tracking some new variants to the original SARS-CoV-2 virus. And these variants are concerning because we know that they can spread a lot more easily And some of the variants are showing evidence that they might also lead to more serious illness. So if we aren't really careful, it could fuel another spike in cases that could lead to even more people suffering long-term illnesses, hospitalizations, and even deaths. So this continued Minnesota spirit of taking care of ourselves and each other is very important for these next few months. The light at the end of the tunnel, the other side of this pandemic, is getting closer every day. And it's very important that we all get there together. So vaccination, along with these other important public health measures, that we keep it up for a while longer, can help us get there. Thank you, Congressman Phillips. Back to you.
All right, thank you so much, Commissioner. We're going to ask some questions of you. Senator Smith and I will alternate, starting with Senator Smith, and we'll do this for just under 15 minutes and turn it over to you, Tina, for the first question of Commissioner Malcolm. Are you there, Tina?
Sorry about that. I was still muted. Thank you. And Representative Phillips and I are going to be asking questions that all of you have sent in. And the first question that I'm going to be asking to Commissioner Malcolm is from Caitlin in Minneapolis. And Caitlin wants to know, when will the vaccine be available to me? She says she's a person in her 30s with no underlying medical conditions and that she's not an essential worker. So, Commissioner Malcolm, when should Caitlin plan on having opportunity to get the vaccine?
Well, as I mentioned, we really appreciate Caitlin and everyone else's patience in waiting our respective turns for the vaccine. And while it's true that while demand for the vaccine is still greater than the supply that we get each week, we get an allocation from the federal government to Minnesota. But we are very much on track to begin broadening eligibility to more of our population soon. We actually have been ahead of schedule in opening up the next eligible stages of the population, and you probably are aware that President Biden has set the goal that all adults who can receive this vaccine should be made eligible by the states by May 1. Minnesota is definitely on pace to not only meet that goal, but exceed that goal. So we're going to be able to very soon, like within the next week or so, roll out a more precise schedule so all Minnesotans can see where they'll be. But I'm happy to say that that day is going to be coming much sooner than we previously thought.
That's great. Thank you, Jan.
And Andreas from Maple Grove asks, where can I get vaccinated once it's my turn, Commissioner?
It's a great question. And one of the strengths we have here in Minnesota is that we do have a really rich network, a diverse network of providers who will be giving the vaccine. Many of us will get a vaccine through our regular healthcare provider, our clinic, for example, or from a local pharmacy, one of the state community vaccination sites, or a local public health department, or possibly even your employer. I hope folks are aware that we've got something called the Vaccine Connector that's on our website, and that's a great place for people to sign up on that Vaccine Connector. And that is a way for us to know that you want to be vaccinated, and we then can reach out to you to say when you're eligible and what specific appointments that might be available to you at state sites, or to receive information about where there is vaccine in your community. There are also other resources, like there's a vaccine locator map on our state health department website that shows who is vaccinating around the state. And the CDC at the national level also has a vaccine finder that is a good resource for folks to be able to find where vaccine is. So I encourage you to check out that Vaccine Connector and the vaccine locator map. There also is a telephone hotline that folks can call if you aren't able to use the online Vaccine Connector. And I'll just read you out that telephone number in case that's helpful for folks. That is 833-431-2053.
Thank you, Commissioner.
That's great. And Jan, I bet if people had, if you are online or can get online, you could probably just type in Minnesota Department of Health, and you would quickly be able to find those online resources, which sound really, really terrific.
Yes, okay, that's right, Senator.
Yeah, thank you. So the next question that I have is from Todd from Chanhassen. And Todd asked a question that I have heard a lot of people asking, and he says he's asking this: is it really necessary to wear a mask and a social distance after I'm vaccinated?
That is a great question, and we do hear that a lot. One important thing for people to remember is that it does take 2 weeks after the second shot, if you have the 2-dose vaccine, or 2 weeks since your 1-dose shot, if you have the Johnson & Johnson. It takes that 2 weeks for your immunity to be fully built up. So if it's been less than 2 weeks since your last shot, you're not yet fully protected. And you should continue to take all the preventative measures until you are fully protected. And even after that second shot, or if you're having the 2-dose series and the 2 weeks, you still should take some steps to protect yourselves and others in certain situations after being vaccinated, like wearing a mask, as you mentioned, or staying at least 6 feet apart from others. And that's an important thing for a couple of reasons, because we don't yet know fully, and we will learn more, we'll get more data as time goes along. We don't know whether the vaccine protects a person from being able to transmit the virus to someone else. We know the vaccines are extraordinarily effective at preventing us from getting sick if we are exposed to the virus, but we don't necessarily know yet whether we can still transmit the virus to others, even if we are not ourselves getting sick from it because of the vaccine. There are, though, situations in which you don't have to wear a mask anymore or socially distance after you're fully vaccinated, and that is if you're gathering with other vaccinated people. You can get together with other folks who are fully vaccinated, and that's we're all looking forward to that, I'm sure. I know I sure am. It's also possible, there's certain guidance on the health department's website and the CDC website about when it's safe to gather with people who are not yet vaccinated, if you're gathering in small groups and there's only one other household. So I won't get into all those details, but there's some guidance on the CDC website and on our health department website that gives you more specifics about when it's safe, when it's not, and the reasons for that. But it is a very good question.
And I think it's fair to say, too, even with 95% success rates, that still means that even upon vaccination, some people will still be susceptible. I know there have been cases in Minnesota, people who've been vaccinated who still contracted COVID. So we all have to be careful for some period of time. My next question for you, Commissioner, is from Becky in Plymouth, who asks about the clinical trials that are underway for 12 to 16-year-old kids. And she wants to know, what is the expected timing for an approved vaccine for kids in that age group?
It's another great question, and Becky's exactly right. Children's immune systems are very different from adults, so they needed to be in their own clinical trials. The original clinical trials did not include kids, and they are underway right now, as Becky indicated. Both Pfizer and Moderna have been conducting vaccine trials, including children down to age 12, and they're hoping to have results this summer. Johnson & Johnson is going to begin testing its vaccine in ages 12 and up, and they intend actually to go into younger ages with clinical trials as well. So we're really hoping that vaccines for those 12 and up will be available by late this year, ideally in the late fall. It's probably realistically the earliest time that these pharmacy manufacturers can get through the clinical trials and through the FDA approval process. It's very important that the public be assured that even though it's remarkable how quickly these vaccines have been developed, they have gone through the full rigorous clinical trial and regulatory approval process. So the earliest I think we'll see pediatric vaccines is later this year for those 12 and up. And for the even younger kids, frankly, it's not going to be until well into 2022.
Thank you, Commissioner.
That's great, Jen. That's very interesting, and I know a lot of families are thinking about that. And also, is it not true that they're starting to do some trials with pregnant moms to understand whether pregnant moms can take the vaccine as well, and how that might affect their soon-to-be baby?
That is true, Senator. Johnson & Johnson in specific is doing planning to do some clinical trials with pregnant women. We do know that a number of pregnant women have taken the vaccine. It's not necessarily contraindicated. There just is not yet specific data on that population. But so far, from everything I've heard, there've been good results in that group. But it will be important to have that specific data.
Thank you. That's good. See, Dee and I snuck in my own question there.
Okay.
Yeah, I think you're entitled.
All right, and I'll give you a hall pass this time for one more.
Okay. All right. Let me ask another question. This is from Jamie in Brooklyn Park, and Jamie wants to know: do I need to get vaccinated if I've already had COVID-19?
Another really good question, and yes, actually, we do recommend that people do get vaccinated even if they have been exposed to COVID. It's been suggested that we don't know whether people's immunity from naturally acquired, if you will, immunity from having had COVID, we don't know how long that lasts. So it's a good idea to get the vaccine even if you've had it, to be just sure that you are protected.
And Commissioner Paul from Chaska wants to know who's paying for all these COVID-19 vaccines.
Well, the good news is the federal government is covering the full cost of the actual vaccines. And I think the congressman mentioned people should be assured that the vaccines themselves are fully paid for. You might be asked when you get your vaccine for insurance information, because your clinic or your pharmacy, wherever you might be getting the shot, is allowed to bill insurance for the administrative fee related to giving you that shot, but there's no charge to you, and that's really important.
And just to reiterate to everybody on the call, if there are some scams around the country right now, if anybody calls you, contacts you, or advises you that you have to pay cash or credit card for your vaccination, that is something to alert the authorities to, because you will not be paying for your vaccine. And with that, Tina, you get the last question.
Okay, thank you. Well, the last question that I have here is this, and I think you've talked some about this already, Commissioner Malcolm, but the question is this, and it is from Amy from Plymouth. What is Minnesota doing to make sure that the vaccine is going to be available to everyone who wants it by May 1st, just like President Biden directed?
Yep, I think we did talk about that a little bit. It's certainly worth repeating that we are very confident that everybody in Minnesota that wants a vaccine will be eligible by May 1st and even before that time. Now, that doesn't mean that everybody's going to be vaccinated by May 1st, but they'll be eligible, and they'll be in line to get it. And we, again, have made a priority, and we will continue to make a priority to make sure that we are reaching out to and finding those people who are at greatest risk to get them to the front of the line, if you will. That's why we first prioritized getting immunization to people in long-term care settings, nursing homes and assisted living, and to healthcare workers, and to the elderly, people over 65, although I don't consider that elderly anymore, because we know that the severity of illness in those populations has been much more severe. More people in the hospital, more long-term care, more long-term health effects. But that's also been true for some of our other populations, and we need to keep prioritizing them as well, those populations that have been hardest hit, who are the most exposed to the risk of COVID by virtue of where they work or their living conditions or underlying health conditions that they have. So we will continue to, even as the entire eligible population of people over 18 are eligible, even as people become eligible, there still is going to be a process of trying to make sure that the folks most at risk are taken care of first.
Well, Commissioner Malcolm, thank you. Yeah, thank you so much for joining us tonight. Any final comments before you sign off and we introduce our next guests?
Well, thank you again for the opportunity. I just want to say thanks to both of you and our entire delegation for your work on the American Rescue Plan. It is just a phenomenally important to give us the resources to be able to actually deliver the vaccines to people, as well as to learn from this and strengthen our systems so that we are ready for the future, as well as helping Minnesotans and everyone in our country recover from this. So I just want to thank you for your hard work. This bill is going to make a tremendous difference in Minnesota.
Well, thank you, Commissioner. The feelings are mutual, and the whole state is grateful to you as well. So thanks for joining us, and I know we'll be in touch. And before we answer...
Have a good evening.
Thank you so much. There are almost 7,500 of us on this call tonight, and before we answer more of your questions, we're going to do another poll. So the next poll is the question, what is the biggest barrier to vaccination for you? Press 1 if it's because you're not yet eligible. Press 2 if it's because you can't get to a vaccination site. Press 3 if you're having difficulty scheduling an appointment. Or press 4 if you've had no issues. Again, the question for the poll is, what's the biggest barrier to getting a vaccination for you? 1, if you are not yet eligible. Press 2 if you can't get to a site. Press 3 if you're having difficulty scheduling an appointment. Or press 4 if you have not had any issues. And now I want to introduce our expert public health panel. We're lucky to have with us tonight Dr. Tim Schacher and Dr. Necka Cederstrom. Dr. Schacher is the Vice Dean for Research at the University of Minnesota Medical School. He's an infectious disease doctor known worldwide for his research in viral infectious diseases. Dr. Schacher and his team have been leading antiviral COVID-19 drug trials in recent months and COVID testing programs and vaccination research. Dr. Cederstrom recently joined Hennepin Healthcare as its Chief Health Equity Officer. She's a recognized national speaker on many topics, including racism, racial disparities, bias, standards of care, and treatment. In her role at Hennepin Healthcare, she fosters community involvement and builds partnerships with the communities served by the healthcare system. We are so grateful to have you both with us tonight. And Tina, I'm going to turn it over to you for our first question to Dr. Schacher. And I'm going to do the 2021 common phrase.
Yes, I know.
You got to
there
unmute
we go.
yourself.
It must have been a long week for us here in Washington.
It sure was.
Yeah. It's great to be with you, Dr. Schacher. And here's the question I'd like to ask you. It is from Shonda from Plymouth. And she wants to know, how do we know that the vaccines are safe and effective?
Another great question. The striking, these vaccines have been developed and brought to the clinic in an extraordinary fashion, and it's an event that's unparalleled, I think, in any modern medical achievement. But I want to assure everybody that the standards of safety in any clinical trial have been strictly adhered to here. I mean, the Moderna and the Pfizer vaccine, the messenger RNA vaccines, which is a new construct, have been studied in well over 60,000 people in the United States and around the world. And, the safety signals are there. And the fact that we've now rolled these vaccines out to as many people as we have And sure, there have been some issues. There are with every vaccine, but these issues have been, related to pre-existing allergies and that sort of thing. It has just been an extraordinary achievement. So, these things are being studied by the FDA on a regular basis. I have no concerns about the safety of the 3 vaccines that are under emergency use authorization in the United States.
Thank you, Doctor. And now we're going to go to our first live caller. Irene in Bloomington has a question for Dr. Schacker. Irene, you should be live. Well, I don't hear Irene, so I know her question, though.
Here.
I see it is... Oh, are you there, Irene? Are you there, Irene?
Hello?
Irene, go ahead and ask your question.
Crap.
Okay. Sorry, everybody. I'll ask a question of Dr. Schacker, and we'll try to get Irene back on. Doctor, question is from Carol in Minnetonka, and her question is: how long after I get both shots am I protected from COVID-19?
So I think the question is, how durable is the protection? So if you're getting the messenger RNA vaccine, the Moderna or the Pfizer, we know that you get really high titers, a really good protection, antibody protection that peaks after the second dose. How long this lasts is still an open question. Will we need to get booster shots or things like that in the future? I don't think we specifically know that, but I do know that those folks that have been vaccinated many months ago are still protected today. And just with the kind of antibodies that are being elicited, we would expect that there'd be long-term protection from this. But it's still too early to put a number on that. It's months, at least months.
Okay. Tina, I'm going to try to get Irene's question in here, and this is for Dr. Cederstrom. The question from Irene was relative to, she has relatives who are at home, not able to likely be brought to a vaccination site. How can homebound people be afforded the vaccine?
Sure. Hi. Thank you for the question. The easiest way is if those homebound people are part of a healthcare system, like, for example, the Hennepin healthcare system, our homebound patients, we established a mechanism to be able to send our nurses directly to their home to vaccinate them in their house. So it would be a good idea to see if the system that takes care of these patients who are homebound, if they have homebound services to have nurses come directly to them. The other thing that is possible is if they are able to have a van or a bus take them from home to a community site. We did a community event at a church, and we had several people who usually are not able to get out and about brought in with wheelchairs to their church, which is someplace that they normally would go. And that's someplace that they usually travel to and maybe nowhere further than that. And they were able to come into the church to get vaccinated using some of the services like the transportation van of the church to bring them and take them back home.
Thank you, Doctor. Back to you, Tina.
All right, thank you. Let's see, there's so many great questions here, but let me ask a question of Dr. Cederholm. This is a question from Rachel in Hopkins. And Rachel wants to know, what have been the biggest challenges to equitable vaccine distribution in Minnesota and nationally?
So the biggest challenge that I would say for equitable distribution in Minnesota is truly around allocation and access. And that arose when there were eligibility constraints. When we first started, age was a great way to set apart who should get vaccinated first. As Commissioner Malcolm said earlier, we really targeted those who we knew were the most at risk, those in congregate living facilities and nursing homes and the elderly. But as time went on, we were clear in the data that it showed that age by itself was actually causing a bigger barrier of inequity. And so those who were receiving the vaccine were significantly older and significantly white in populations. And when you look at the data, what it showed was Black and brown populations in Minnesota have significantly lower life expectancies. And there's a multitude of reasons for that, all of them stemming from systemic racism issues. But as a result of the cutoffs, that took them out of the eligibility to get vaccinated because there just weren't that many people who made it to 65. And so when you look at the population of who was getting sick the most, who was in hospital the most, and who was dying the most, it was these populations of color, but they were at a younger age. So by just having age in of itself in the beginning, that made the inequities grow.
Thank you. That's very helpful to understand.
And Dr. Cederstrom, we have one more question for you from a live caller. We have Mason from Wayzata live on the phone. Mason, you're live.
Hi. My question is, what is the current plan, if there is one, to get the vaccine to our growing unhoused populations? Thank you.
Yes, thank you. That is a great question. So I know that right now in Hennepin County, we have partnered with Hennepin Healthcare and the Hennepin County and the Public Health Services for Hennepin to specifically vaccinate our homeless or our housing stressed population. And it is a very difficult thing, as you can expect, especially with the vaccines that we have available, that they require the double dosing and require special handling, especially if it's the Pfizer vaccine. So as more vaccine becomes available, like the Moderna vaccine or even the best one for this kind of situation, the Johnson & Johnson vaccine, where we don't have to worry about the logistics of trying to schedule someone who's housing insecure to try and get back to the same location. But Hennepin Healthcare has done a phenomenal job with the county and public health to vaccinate the homeless population.
Thank you, Doctor. Back to you, Tina.
Thank you. So this is a really interesting question. I'm for Dr. Schacker, and it's from Christine in Wayzata. And Christine wants to know, what's in these vaccines?
That's a great question. Given all of the conversation that we've had about how these are new constructs, these are a type of vaccine that hasn't been used before. And so the easy one to answer is the Johnson & Johnson. That's a more traditional vaccine that has been used for years. It has another virus attached to it that helps to stimulate your immune system, and it's also got a small piece of the SARS-CoV-2, the cause of COVID-19. It's got a small piece of that virus attached to it. So your body makes an immune response to that. And that vaccine that construct has been used for years. The messenger RNA vaccine, this is a fascinating story. It's a little piece of the nucleic acid of a part of the SARS-CoV-2 virus. And that little piece of nucleic acid, the RNA, the building blocks, if you will, is surrounded by some particles of lipid or fat, and you inject that into the person, and the particles will get into cells at the site of injection, and the RNA, the RNA from the virus, will be made into protein that's part of the virus that the immune system can react to. So it's a novel delivery system. So there's no, I know there's a lot of concern about, how these things are engineered, how they're made, if there's animal parts in it and that sort of thing. The answer is no, not in these particular vaccines. The messenger RNA vaccines are made in the laboratory, and they're just extraordinarily effective.
Thank you. That's so interesting.
And Dr. Schacker, we have another question for you from a live caller. Lisa from Coon Rapids is on the phone. Lisa, you're live. Is Lisa there? All right, well, if not, we'll try to get Lisa back on the line. In the meantime, Doctor, does it make sense to get vaccinated if I just recovered from COVID?
The short answer is yes. As Commissioner Malcolm said a few minutes ago, it's not clear how long immunity lasts from natural infection. So if you acquire the infection and are symptomatic, or even if you're asymptomatic, we don't really know how long that lasts and how protective those antibodies are. We know they're somewhat protective for sure. The question is timing, and what the current recommendation is, if you're recovering from COVID-19, we know that you're protected from reinfection for a period of time, and the recommendation is that you wait at least 90 days or 3 months after the symptomatic infection, if you will. The same is true if you get the infection and then you get one of the monoclonal antibodies, the Regeneron product, for example. The recommendation is that you wait 90 days before you get vaccinated. But absolutely, you should be vaccinated.
Thank you, Doctor. Tina, back to you.
All right, thank you. So I have a question for Dr. Cederstrom, and this is a question from Leslie in Brooklyn Park. And here's what Leslie wants to know. She says, why aren't there more mobile medical vehicles being used and widely publicized for available shots in lower income neighborhoods where folks might not have a car or an ability to travel? And she's wondering whether we shouldn't be giving shots to people in their homes. Dr. Stevenson, tell us a little bit about that. And I think you answered a bit of that a minute ago, talking about what you all are doing at Hennepin Health. But tell us about that, how you see that.
Yeah, sure. So we've explored actually a lot with trying to figure out how to use our mobile vaccine van to get into communities. And part of the problem, at the beginning at least, was with vaccine handling. The Pfizer vaccine was out the first, and it requires special temperature and special handling, and to ensure that we get people dosed twice. So, and then Moderna was less requirements with the handling, but also needing to make sure that people get dosed twice. So there's a lot of logistics when you have to use a mobile vehicle in order to do your vaccinations. Now, there's the possibility of doing some scheduled visits with some of our populations that usually get our care through our mobile vehicles, like through our pediatric population and their caregivers. Those are people who are known to us who use our mobile vans all the time. And when it's available for them, I think our mobile vehicles will be able to do that. But there is a possibility of increasing the use of mobile vehicles for vaccinations when there's more Janssen vaccine available, because it would be a perfect opportunity to set it up in a parking lot and have a vaccine event and be a one-and-done kind of an opportunity, which we could easily start to do. But initially, it's a logistics issue, and we need to make sure that everyone who signs up with us is able to get our second shot.
Right. Thank you. That's great. Thank you so much. Dean?
And Dr. Cederstrom, this next one is for you. We have Inga live from Eden Prairie. Inga, you're on the line.
Hi, good evening. I'm curious to know, how are we ensuring that every dose is used and not going to waste? I have firsthand knowledge that some citizens are setting up multiple appointments. I also know that there are open vials that are going to waste because not everyone can honor those multiple appointments. So is there a waiting list for lower priority citizens that can get added to and get contacted if there is an available dose?
Thank you for that. Yeah, the vaccine is our liquid gold, right? So we want to try our hardest to make sure it gets in every arm that we can get it into. We have had, in several situations through our clinics at Hennepin County Hospital, to have the evening rollout of calls of, we have X amount of doses, we have no more people showing up that are already regularly scheduled, or we had X amount of no-shows. So then we start calling people who are patients of ours. We look at folks who are already in our clinic to see if they're eligible and haven't yet signed up, in order to make sure that we use the doses. We established an opportunity for our employees who have family members at home who are in the high-risk area to be put on a priority list for that last-minute shot. If we don't have anyone eligible in our patient population, we can pull our employees and ask them if they have parents at home who haven't yet gotten their shot, or elderly grandparents who are eligible and haven't gotten their shot. And that worked really well to help get a lot of our high-risk populations that are part of our employee family to get those last-minute shots. But it is really difficult because you never know when someone's not going to show, and you have no idea how to prepare for that. We oftentimes, in scheduling our clinics, put a percentage over just as a possibility for no-shows. We try really hard to make sure that there's none that's left. I have not yet had a situation where I've heard that we've had significant doses left that have not been able to be used within 24 hours to make sure that we haven't wasted any. I'm not sure, though, about in some of the areas like pharmacies out in the communities, whether they've had problems with extra dosing. I know that I've had many people tell me that they've called around at CVS's and Walgreens and have just said, if you had any extras, please let me know, I'm looking, and they've been successful that way. But I don't know if there was like a standardized form that someone could sign up from in one of those situations.
Thank you, Doctor. Tina, back to you.
Great. So this is a question for Dr. Schacher, and the question is from Pat from Medicine Lake, and Pat is asking, are there differences between the 3 vaccines that are currently authorized in the United States? Is one better than the others? This is interesting. There's been some stories about people that are vaccine shopping and saying, oh, I want to wait for this one versus that versus another one because I think one might be better. So, Dr. Schacher, what would you say? What would you tell Pat?
Yeah, this is a really common question, and it's an important thing to talk about. The conversation over which vaccine to get, I think, stems from the data from the original trials showing that one vaccine has better efficacy than another vaccine. And what they mean by that is that when you get the vaccine, you're protected from significant clinical illness. And with the messenger RNA vaccines, that's reported to be in the 94 to 95% range. And with the Johnson & Johnson, that's in the high 70s. The one thing I want to stress is that, I think most of us who study this, we're hoping for a vaccine that would be in the, high 60s, low 70s. That would be a home run. And we now have 3 vaccines that exceed that significantly. And so what I tell people is, and I tell my patients this, take what is available. The most important thing for us to do is to get vaccinated so that we can get to herd immunity much faster or as quickly as possible. Dr. Malcolm mentioned that there's this emergence of, or Commissioner Malcolm, that there's the emergence of these variants. And in some ways, we're in a race against those. So we need to get as much vaccine into the arms of Minnesotans as we can. All 3 of them are really excellent vaccines. And I have no hesitation about recommending any of the 3 of them to my patients. So I say, take what you can get.
Thank you. I think that's such a great answer, and it's really important. I think sometimes we focus on those percentages that you were talking about, Doctor, and the thing that is what I've heard is really important is how good a job do these vaccines do, any of them, how good a job do they do at keeping you out of the hospital with a really serious illness or even a lethal illness? And the answer is that all of these vaccines are very, very good at keeping you from like the worst outcome of this disease, right?
Absolutely. That's absolutely true.
Thank you. Dean?
And Dr. Schacher, we have another live caller for you. Jennifer from Coon Rapids is on the line. Jennifer, you're live.
Hello.
Hi, Jennifer.
Hi. My question is, with the variants and with the 2, Pfizer and Moderna, they don't really cover the variants like from South Africa and the UK. Are we going to wind up getting a 3rd shot?
What's important, I think, to stress is that it isn't that they don't cover the variants from the UK or South Africa. It's that the what I just mentioned as efficacy goes down. So you're not as well protected, but you're still protected. And so what is happening is that the all 3 of the vaccine companies Pfizer, Johnson & Johnson, and Moderna are making booster shots that cover these variants, and those booster shots are in clinical trials now. And we're hoping that they'll be available, once they get through the FDA process, by the early fall. But you raise an excellent point, and that, some of these variants that might emerge could lessen the ability of the vaccine to protect you. And so it just, again, it stresses this race that we're in, that we should get as many people vaccinated as quickly as we can. But I do want to stress that the variants that we know today that are circulating in the United States, the vaccines that we have still offer probably good protection, and you should rest assured with that and get your vaccine.
Great. Thank you, Doctor.
Yeah.
Tina, back to you.
Thank you. So here's a question from Joseph in Brooklyn Park, again for Dr. Schacker. He wants to know, what are the side effects of these vaccines?
So we break that down into, the immediate side effects and then the long-term side effects. And the immediate side effects that, they're pretty standard for with respect to, the kinds of things you'd expect. Some people will have allergies. That's true of most vaccines. Some people will have injection site pain, redness and swelling and, not feeling very good. And then, the experience that we've had thus far, at least with Moderna and Pfizer, is that the first shot goes pretty well. People might complain of a sore arm or something like that. The second vaccine, in some people, can cause more noticeable side effects. You might get a fever. You might have aches and pains, or aches, and that sort of thing. It's a flu-like illness. And that is a sign that your body is reacting in an appropriate way to the vaccine. So it's, you ask the question, is it worth a day of those symptoms to be protected from COVID? And my answer is absolutely. When I say the long-term side effects, that I think is the discussion that's happening around the long-term safety of these vaccines. We have no signals that there are long-term side effects from these vaccines, but that is being actively studied. And, I think the scientific community recognizes the concern, and as we would with any intervention, new intervention. And so there are, follow-up trials that are happening just to ensure the long-term safety of these vaccines.
Great, thank you.
And before we get to our next call, just to remind everybody, if you wish to ask a question tonight, press *3 on your phone. Again, that's *3, and one of our team members will take your call. We have 7,522 people on the call right now, so we're not going to be able to get to everybody's question, but we're going to do our very best to follow up with you accordingly. Again, *3 if you have a question. And if you want to sign up for my email updates about the work I'm doing in Congress, you can press *6, and someone on our team will get you signed up. Again, *3 for questions, *6 for updates. And with that, we have another live caller on the line for you, Dr. Schacker, Mary Ellen from Bloomington. Mary Ellen, you're live.
Hi. Can you hear me?
Yes, we can.
Hi.
Okay. I was wondering if there's any studies being done about COVID, on the effects of COVID, like breathing disabilities and that.
Yeah, that's a really great question, and it's a topic that has gotten a lot of attention recently. We call that long COVID. So it's those people who recover from COVID have symptoms that are related to the illness that persist for an extended period of time, long COVID. It's actually a fairly common issue. Most people who have long COVID, they experience fatigue and those sorts of symptoms. But some people have more significant symptoms after recovering from COVID. You may have heard of the term brain fog or other, brain type things, problems with memory and that sort of thing. And there's even other clinical problems that persist even longer. So there is a lot of attention to long COVID. I know that we, in our healthcare system, Health Fairview, we have a long COVID clinic, and I know several of the healthcare systems around the state are doing that as well, because we really don't understand how long COVID works, why it happens, and what are the best treatments for it. But it's just another reason to take this seriously. Get vaccinated, wear your mask, stay 6 feet apart, and this will be over sooner rather than later. But, one of the things that you very correctly point out is that there are some concerns in people who recover from COVID that we're just now starting to learn about.
All right, thank you, Doctor. Tina, back to you.
Thank you. That's I think that's very interesting. And just as you say, Dr. Chakra, that's such a good reason for us to understand that this is not like a typical flu, and it is something that you do have to be particularly vigilant about. Dr. Cedarstrom, I have a question for you from Danielle in Brooklyn Park. And Danielle says that she knows a lot of people who are getting vaccines through the doctor or the hospital that they normally go to. But she's wondering, what can people who haven't recently seen a doctor do? Like, where should they go to get connected with the vaccine?
Sure. Thank you, Danielle, for the question. So I think that it depends on how long ago you haven't seen the doctor. When we put the call out from Hennepin to our patient population, it went out to people who had been part of our clinics in the last 2 years. Sometimes we went as far as 5 years. So if it's longer than that, then what I would say is you have the opportunity to still sign up and become and get primary care services from someplace like Hennepin and get your vaccine through becoming one of our patients. But there are also many community clinics and many community avenues that people who don't have primary care services can use. And we have almost weekly community events throughout the entire county, and they're open to all who are eligible. So if there's a local community faith group or some of the community centers that we are partnering with, and you don't have a primary care service and you don't feel like signing up for one now, if you're eligible, please feel free to reach out to them and sign up and get a vaccine through those avenues.
That's great. Thank you.
And Dr. Cedarstrom, another live caller for you. We have Abdallah from Brooklyn Park on the line. Abdallah, you're live.
Yeah, hi. Thank you very much for taking my call. My question is, what is Minnesota overall, both our elected officials in addition to also, our MDH, Minnesota Department of Health, doing to reach out to underserved population, especially the LEP, the limited English-speaking families, as we know that we have about tens and thousands of them that, are in need of services, and how can we get information disseminated to them in particular, and what's being done at this point? Thank you.
Yes, thank you for that. I can say that the MDH is doing a great job with partnering now with Dr. Nathan Shomalo in his new role as a health equity advisor to help figure out things like making sure that those populations, limited English speakers, populations of color, are being targeted. Those of us at Hennepin Healthcare are also doing our best to try and get to those populations. We had an event last Saturday where we used our interpreters to make phone calls specifically to our LEP population to have conversations and help to reach out to tell them that we had an event and we were trying to sign them up. And we were really excited that almost a third of the people who showed up were native Spanish speakers who had not had an opportunity to get vaccinated and only were able to come because we did the extra work of calling everybody and having a conversation in their language. We're also creating tons of materials to deliver to many sites within the community that serve LEP patient populations, to give them reading materials, visual materials. I have the opportunity to work with those sites to help set up a vaccine event so that they can just sign up to get their vaccine through that area and not have to worry about or be concerned with figuring out how to use an online system that may not be translated in a language that they understand, but they can have a conversation with their local mosque or with their local church that speaks their language. And then we partner with those faith places in other community centers and have vaccine events there so that they can come with messaging and paperwork that's in their language and have other people who speak their language help them through the vaccine process. It is definitely a lot of extra work, but it's the work that we have to do. So we take our time and we try to be deliberate in finding out where these patient populations are that may not have had anybody target them, and do our best to reach out and ensure that we're making every effort that we can to get to them. I know that we've got a event coming up that is probably 87% Spanish speakers, and it's going to be a couple of hundred patients specific for that event. And then we have another event that's specifically dedicated to the Oromo community, and some that are for the Somali community. So we are working really hard at ensuring that we get to all these different people.
Thank you, Doctor. We've got about 10 minutes left, and Tina, turn it back to you.
Well, thank you. I wanted to just note that I really appreciate Dr. Cedarstrom, your answer to that. And I'm reminded that on Friday of last week, I had a chance to visit the Boyce Fort Vaccination Center on East Franklin. And I think it links up with what you're talking about, that their work is funded in part through Indian Health Service and also through the CARES Act funding that Dean and I strongly supported earlier last year, and will be supported again by the American Rescue Plan to get, again, that mobile vaccination unit resourced well, with vaccines in hand, with vaccines provided by a trusted community provider. And it seems, Dr. Cedarstrom, that that's sort of the magic formula for how to reach communities who are going to go to places that they trust to get this vaccine. Does that seem right to you?
Yes, indeed. And that has been the model that we've been using since early February, when 65 and up was when we were allowed to start vaccinating our population. We have tried really hard to partner with these trusted community messengers and the faith-based organizations, community centers. We've looked at neighborhood associations and minority-owned businesses to try and offer opportunities within the community to give vaccine to the people who need it the most. And we are always open for more. So if anyone has any trusted community messenger that they think would be interested in partnering with Hennepin Healthcare to host a vaccine clinic, please feel free to reach out to us. You can email us at healthequity@hcmed.org, and we will be really eager, because I think that the only way to truly get a more equitable access to vaccine in the populations that we know need it the most is really to go out and be there for the people, to provide it to them in a manner that helps them get it with ease and without any additional barriers or make them jump through any additional hoops. And that's the way that we can close this gap.
That's great. That's great. And I think it also helps to overcome some of the historic reasons that communities have for not always trusting. And I think that makes it even more powerful.
Yes. The way to build trust is to actually reach your hand across, right? So that's the way we're doing
Exactly.
it. We're going straight to them and asking, how can we help you?
Thank you. Dean?
Great. Well, next we have Gerald from my hometown of Deep Haven on the line. Gerald, you're live, and a question to Dr. Shacker.
Can you hear me?
Yes, we can.
Yeah. All right, great. Thanks a lot. I really appreciate a lot of your input here. And my question kind of centers around the Pfizer and Moderna, the new platform you kind of mentioned. And there is a difference between emergency authorization use and full FDA approval. And my question, I'd like your thoughts on, given this is new technology, is this the right forum to fully vet, or a right kind of approval construct to fully vet, you know, the upside and the downside, the risks, and what you get out of it, in your opinion?
Yeah, no, I appreciate the question. My short answer is yes, I think it is. It isn't that the messenger RNA vaccines are, you know, something that we've never experimented with in the past. It's just that we've not used them in humans before. The concept of this vaccine construct has been around for actually quite a while. We're in the middle of, as you know, a pandemic that's killing hundreds of thousands of people. And so, you know, this vaccine was able to be, so the success story is, you know, the sequence of SARS-CoV-2 was published, I believe it was on January 15th, 2020. And within a week, these vaccines had been started to be designed in the laboratories at Moderna and Pfizer. And, it was relatively easy to make the vaccine and to begin preclinical trials, animal trials, and then human trials. So did this happen fast? Yes, it did. But I think that's just a function of the extraordinary need of the pandemic. And, everything is a risk versus a benefit. And I very much believe that was the right thing to do. That I believe, and I think the data are very strong that we are protecting millions of lives by doing this. I really can appreciate that there's a lot of concern over the speed at which this happened, but I do believe it was the right thing to do.
Thank you, Doctor. Tina, it looks like we have time for about 2 more questions. One
Alrighty.
From you, and then I'll take one, and then we're going to wrap it up.
Okay, sounds great. So I am asking a question on behalf of Linda from Maple Grove, and Linda wants to know, she's wondering, are we going to need a booster shot for variant strains of COVID-19? Maybe go ahead, Dr. Schacker.
Yeah, so the answer is probably. As I said, we know that the variants or that the immunity that you get from the current vaccines, is not as good for protection against some of these variants. And so just like we get a yearly flu shot that covers the strain that has emerged, it is likely that we're going to have to do that, at least over the short term, for the variants that emerge. As I said, it's a race against the variants. So there will be boosters in our future, I think, for sure.
Yeah. Similarly to the way we take a flu shot every season.
That's a possibility, yeah.
Yeah. Thank you.
And next we have Teresa from Brooklyn Park on the line. Teresa, you're live.
Hello?
Teresa, yeah, you're live, and I think your question can go to Dr. Schacker.
Yeah, hi, Dr. Schacker. This is Teresa Namwe from Brooklyn Park. I have a question about you taking the vaccine has something to do with changing your DNA?
So the question, correct me if I'm wrong, but I think the question is there a risk from these vaccines that it's going to somehow alter the DNA of yourself?
Yes.
Yeah. No, there's no risk to that at all. The vaccine that you get causes your body to make a protein. It doesn't interfere with your DNA structure at all. It just harnesses the machinery of the cells to make the protein that you make antibodies against. So no, there is no evidence of that at all.
All right, thank you, Doctor.
Yeah.
Mm-hmm. Oh, yeah. Doctor, I want to thank you, and it is now, unfortunately, time to wrap up. There are about 7,500 of you on the call. I know many questions probably still to be asked, and again, we will do our very best to those of you who provide information to follow up accordingly. So with that, Tina, I'm going to turn it over to you for any closing remarks you want to share with our wonderful group tonight.
All right. Well, great. Well, first, I want to thank everybody who's on this call for joining this conversation, for, I hope, getting many of your questions answered. It just is so great to be able to be with all of you. I especially want to thank you, Representative Phillips, for your consistent interest in listening and engaging people in the questions that matter in their everyday lives, and then going to Washington to try to figure out how to solve problems for people. I think I just deeply admire your leadership, and I think that this teletown hall is a great illustration of the leadership that you bring to your district and to Washington every day. And thank you so much to Dr. Schacker and to NECA Cederholm, Dr. Cederholm, for joining us today and for answering a lot of the just really practical questions that people have about what this means. I hope that people are leaving this conversation with a sense of clarity about how these vaccines are safe and effective, and it is in some ways kind of miraculous that we were able to produce these vaccines on such a speedy timeline, but we also know that we can trust them, and that you can hear in the conversation that we've had about our commitment to make sure that those vaccines are getting equitably distributed in the community, which I know is just so important. So thank you again so much, Dean, for convening us, for bringing this together, and for creating a way for people to get their questions answered. And I've really enjoyed hearing what everybody is thinking about tonight.
Thank you, Tina, and thank you for representing me and all of us. We're very grateful. And to Dr. Shacker, to Dr. Cedarstrom, thank you so much for sharing your time with us and your expertise tonight. As I've said, 7,500 of you took the time out of your nights to join this call, and I am a very fortunate and humbled man to represent all of you, and grateful for that opportunity. And there's a lot to be proud of the work that we've done to get through this horrible pandemic, but we have a lot of tough work ahead. And my promise to all of you on this call, frankly, whether you voted for me or not, is that I will always listen, I will always learn, I will always advocate for you, and I ask that you continue to share your stories and your ideas, even your criticisms with me. All of those make me a better representative for all of you. I'm going to continue my efforts to increase the supply of vaccines and strengthening the distribution of the vaccines to all of you, while pushing our state leaders to ensure that every dose is administered to every eligible Minnesotan as quickly as humanly possible. And as a small business owner myself, an entrepreneur, a father, a son, and your representative in Congress, I know how frustrating this rollout of the vaccines has been. Stops and starts at times, hard to identify information. And I know how devastating the pandemic has been to so many. Some of you on this call have surely lost loved ones, suffering the effects of COVID and the economic effects of the entire pandemic. And I want you to know I empathize. And I want to assure all of you that protecting our workers and small businesses and all of your families will continue to be my very highest priority as we work to shore up our economy and keep people safe for our reemergence, which is soon on the horizon. And if you haven't done so already, I do encourage all of you to sign up with the Vaccine Connector so that the state can eventually notify you where and when you are eligible to be vaccinated. Now, that's the Vaccine Connector. And for that and any questions you might have about COVID-19, you can always call the Minnesota Department of Health at 651-297-1304. Again, that's the Minnesota Department of Health, 651-297-1304. You can also reach them toll-free at 1-800-657-3504. And healthcare professionals and scientists have been working literally around the clock for months to create vaccines that will allow us to beat this virus. And the fact that they were produced and delivered within a year is remarkable. And credit is due, frankly, to both administrations, the past and the present, to have done so with expediency and to get them in people's arms as quickly as possible. So I do encourage all of you, even those of you who are hesitant, may have read some information that made you concerned, I encourage you to all take the vaccine as soon as it becomes available to you. It is part of our collective responsibility as Americans, and one of our freedoms, frankly, that we can make that decision and help protect one another in our community and keep everybody healthy. And when you do receive your shot, please continue to wear your mask, practice some social distancing, and please keep washing your hands. It is important because not everybody has been vaccinated yet, and the truth is, even with 95% effectiveness, that still means that if everybody in America was vaccinated, 15 million people still would be susceptible to the COVID-19 virus. We are going to reopen. Life will get back to normal, at least a new normal, but we all have to be diligent, and I encourage and invite all of you to protect one another. So with that, I encourage you to please keep in touch, to keep the faith, and to keep your optimism up. We are going to get through this. It has been an extraordinarily difficult year for all of us, but we are so lucky to be Americans. We are going to emerge stronger, we will emerge more united, and we will emerge a better America than we were before. But it is going to take all of us. So I wish you all Godspeed, and rest assured, Senator Smith and I and our colleagues will be here for all of you. So stay healthy, keep the faith, keep in touch, and many thanks, everybody. Have good evenings. Bye-bye.